Ryan Poplaski is the owner of Bodywise Physical Therapy in Epping and soon to be Stratum, right?
Yes, thank you.
So
Yep.
very
June
exciting.
1st.
So go ahead, Ryan, take it away, baby.
Yes. Thank you for having me today. I am going to be talking about bone health. And yes, a physical therapist. I started off in Epping, and we're opened up a second location in Stratham. We have a practice of 6 or 7 physical therapists. We've been here around here since 2007 or so. And, I love working with people, getting them back to the things that they love to do. I think that is very beneficial. At our clinic, we focus a lot on how the patient experiences, and we try to make this a unique um, experience for them. So we really focus on the patient more than anything else. I'm going to share my screen so we can jump right into the topic today, which is bone health, which is something that everyone should think about if you're 40 years old and older. And I'll talk more about that in just a moment. Um, Here. All right. So this is our Epping clinic. Um, and let me see if I can get right into it. All right. Now, bone health. So, did you know that astronauts, and that's what you're looking at right here, lose bone mass at 1.5% per month in space? And you may be thinking, why am I starting off by talking about astronauts when we're referring to bones? And this is going to be a very important point later on in the talk. So just kind of remember this fact that because they're weightless and they're kind of floating around in there, their bones start to degrade at 1.5% per month. And it can actually get up fairly dangerous levels if they stay in space longer, 6 months or more. So I thought that was a pretty interesting fact that you can keep in the back pockets to tell your friends. So when we lose bone mass, we lose that as we age, and we actually start losing that. They say 40 or older, but if you're over 70, you can lose over 30% of what you had when you were 20. And we all don't feel like we're 20 anymore, but you got to remember your bodies are also responding differently too. So look at that picture here. I hope that everyone can see that. And you see that normal bone density on the left. And that's, really, when you're 20, you have strong bones. You can fall down and not worry about it. But as you start to age, you lose bone mass. That's just a natural fact of aging. And you can start to have a bone that looks more like what you see on the right, that where it's a little bit more air than there is bone in every aspect. So you can see how as older adults, when they fall, they have a lot more opportunity for damage because of that. And the breaking a bone is a lot easier. Here's another example. And I'm just going to touch on osteoporosis. That's a huge topic, and that's definitely part of the bone loss, what you talk about. Osteoporosis is very dangerous, as you can see from this picture here, and how that degrades the bone over time. It's responsible for 2 million fractures a year in the US. 2 million fractures are responsible for because of osteoporosis, because of bone loss. This can, osteoporosis can also lead to pain with movement, and then eventually can, result in surgery because of the pain, result in surgery because of the fractures associated with it. And it contributes to the majority of fractures in people we see over the age of 65. So think about that. It starts in our 40s and progressively starts to get worse. And talking about, bone loss and that's us, what can we do to prevent this from occurring? Well, this is a natural occurring thing that does happen in every one of us. However, we can slow this down. And I want you to kind of think about that astronaut again. They're in space. There's no resistance on them. They're floating around out there. And, bone responds in the fact that if it does not have any resistance on it, it starts to degrade. We can reverse that equation And if you add resistance, you can increase the density or at least decrease the grading of bone over time. So be like an astronaut and prevent bone loss by weightlifting. Resistance training, essentially. Resistance training at any age can slow bone loss and even build it back by stimulating the bone cells. So that's how that works. So with that resistance, you can actually start to build some of that back. Resistance training also targets the joints most susceptible to fracture, such as the hips, the spine, and the wrists. And think about, as we get older, where are the areas that hurt the most? You get the knees, you get the hips, of course your back, and over time the wrists too. People complain about wrist pain very frequently as they get older. Now, this is only part of the equation, and proper nutrition and supplements is the other side of that, and it's just as important. I am not a trained nutritionist, and there's a lot of other people who are much more qualified to talk about that than I am. I'm going to talk to you about bone health and what we can do with resistance training. So we're going to focus on that, and I'm sure that Crystal will be able to elaborate more on that, and she would be the better person to talk to on that further. Talk about supplements, though. I'm taking supplements. I'm in my early 40s, and I'm taking a calcium supplement. And I'm a guy who traditionally won't have as much bone loss as a female. So that's a little bit of food for thought. So why resistive exercise? Let's dive into that. Resistive exercise has been proven to be more effective than low impact exercise such as walking, biking, or swimming in regards to bone health. And I want to repeat that fact because that's a very important thing that even I was surprised at. The fact that if you go walking every day and say you go swimming and you think you're doing that as a benefit to your joints because it's easier than running, you bike and you think you're getting a good enough exercise with that is not enough for your bones. That is not enough for your bones. It may be great for your heart, and it is exercise, so it's better than sitting on the couch and eating bonbons, but it is absolutely not enough for the bones. Resistive exercises is safe for all adults, even with a history of fracture. We're talking about people who have severe osteoporosis. They can still utilize resistive exercise. In fact, it is warranted. It is recommended. However, the intensity and type of resistive exercise is important and should be presented by a professional, especially when pain is involved. And that is another really important part of this, is that when you're talking about resistive exercise, which ones to do are going to be very important. And if you have a history of bone loss, or if you have a history of pain, that's something you really need to talk to a professional. If you have current pain, if you have current restrictions, I'm the professional you need to talk to about that. If you're past that and you're looking to start a program, if you're looking to continue a program, if you're looking to progress a program and you don't know where to start because you've had a history of that type of thing, it's Crystal, it's the personal trainer that you need to talk to with that. And I would not recommend starting a program if you haven't been exercising for a while on your own because of these facts associated with this bone loss. And I kind of knew this going in, but when I was doing research for this talk, it really, I was surprised by how effective that resistive training can be for this and how important it is to really talk to a professional first. So that was kind of surprising for me. The World Health Organization recommends people over the age of 65 and who starts on a resistive exercises, including major muscle groups, should be done for a minimum of 2 days a week. And we've seen studies in the physical therapy world with this, but we're talking about the World Health Organization, and they say that 1 time a week is not going to cut it for your joints, for your muscle groups. There's too much information out there that show you need to go at least 2 days a week. And I say 2 days a week because in the physical therapy world, we look at goals and people meeting their goals. And we find that people who only go 1 time a week have a 45% chance of meeting their goals. But if you go twice a week, you have a 96% chance of meeting your goals. And that's a huge difference. And they say if you go at least 1.6 times a week, then you have like a 92% chance of meeting your goals. So essentially it's 2 times a week. But that's 2 minutes. I won't dive into those details. Um, so what you need to ask yourself is who, not what. Meaning, what type of exercise, for what intensity, for what duration, and what type of schedule can be very confusing. Finding out who can help you um, not only choose the right exercises, but progress these exercises is very important. That's where utilizing someone that can help you at home um, through some personal training is very important. So think about that. Find out who can help you with this, not what you can do. Um, so why do you use a personal trainer? Why should that be important? They can adjust your routine to match your health and body style. That's really important. They can look at your posture and movement. I know they do functional movement screens, and that's super important and really undervalued in many ways. They can recommend a few exercises that fit your goals and to really listen to what you're looking for. And they can develop a program for the future. I think that is a important part to remember, that it's not only just now, but they can also say, this is what you need to do in 2 weeks. This is what you need to do when you reach this goal. Um, you know, and they're perfect people to recommend a appropriate resistive exercise program. And if you're younger, then that resistive exercise program can be very broad. You can do a lot of different things. But as you get older, and really when you get past 30, honestly, that has to be very specific because of the risk of injury. Sorry. And then as you get older than 40 and start to get into your 60s, now you're really looking at bone loss and the risk of fracture. And that's a very specific resistive training program at that point in time. And that's why you really should talk to a professional moving forwards. Now, there's a lot of information there. I'd be happy to answer any questions on that. Does anyone have any questions on bone health? I go over certain things, talk about osteoporosis.
I have a quick question. Do you recommend a bone density test?
Jackie, you always have the best questions, I have to say.
She does. It's true.
Honestly, like, she is on point all the time. Yes, absolutely. And I would say that for people, if they have a family history of that, if they haven't exercised in a long period of time, they should have that